Wondering what the safest, most effective way to take care of your kid's skin this summer, you are going to want to stick around. I am joined by pediatric dermatologist Dr. Luke Johnson from the University of Utah, and we are going to be discussing all things summer skin for your child. Things like what sunscreen is really safe for your kids, and are there other ways to protect your baby skin from the sun? How to take care of your kids' eczema, and whether you really need to put the whole family on a restrictive diet, and also things like how to prevent and treat bug bites and tick bites. If you have a child, you definitely are going to want to check out this episode all about how to take care of your kids' skin this summer. Let's get into it. Dr. Johnson, it's so great to have you back. You were on, I think it was a couple of years ago, which is hard to believe, and talking all about warts. And now we're going to talk even more about pediatric conditions. So thanks for being here.
Happy to be here. Looking forward to it.
You're a pediatric dermatologist, right? And I know there are tons of people out there who have questions about their children's skin. And, people are asking me too. And sometimes I'm dumbfounded. But one of the main things I'm hearing a lot of people concerned about is whether sunscreen is safe for their kids. And it seems like there's this movement of parents who do not want any sunscreen on their children. So let's just start with that. I know it's a big one.
I haven't seen a lot of that, but there was a study published in 2019 where the FDA showed that chemical sunscreen ingredients get absorbed through your skin into your blood. They can detect the ingredients in your blood, which is somewhat off-putting, but they didn't find that those substances in your blood did anything bad. My personal feeling is that if they did anything horrible, we probably would have figured it out by now. But still, to be extra careful, especially for kids, I recommend that parents use mineral based sunscreens. And of course, you know this, and I think a lot of your listeners probably do, but just for those of you who don't. So, we dermatologists like to divide up sunscreens into two different categories. There are the chemical based sunscreens, which have active ingredients that you probably can't pronounce that have lots of syllables. And then there are the mineral based sunscreens, which are zinc or titanium or sometimes iron. And the chemical based sunscreens are molecules that absorb the ultraviolet radiation and then get used up. And the mineral based sunscreens are what we call physical blockers. The sunlight just bounces off of them. And that's why some of them look kind of white, leave you with a little white sheen, because there's actually little tiny metal particles on top of your skin and the sunlight bounces off of them. There's a lot of technology now that makes those particles extra small to minimize that sort of white cast that you can get, but that's why it's there. And there have been studies that show that those stay on the surface of the skin where they belong. So for kids, to be extra safe, I think the mineral sunscreens make a lot of sense. I know a lot of my colleagues recommend mineral-based sunscreens even for their adult patients. I personally don't think it really matters very much for adults, especially if you're done having kids and stuff. There's some concern that these chemical-based sunscreens could potentially do something to hormones. Again, I'm not convinced, but if you want to be extra cautious, you could use one of those. But mostly it's just a challenge to get people to use sunscreens. So especially for grown-ups who sometimes have opinions and can choose whether or not they put something on their skin, unlike kids who normally just have to be forced to do something. Whatever they are willing to put on, I think is fine.
Something is better than nothing for sure. And yeah, I think one of the biggest complaints about mineral sunscreens is that they can leave that white chalky residue on the skin, especially if you have darker skin. Although I will say nowadays, a lot of them are really elegant. I've been amazed. And I think for people listening too, more recent data is showing that even the physical blockers are absorbed and don't just act as a shield. So it's not like you're going to have zero absorption with either of those. But yes, I think people did hear about the study. They're worried about chemicals being absorbed in the body, but I'm glad it didn't show any harm. It just showed that, yes, they're absorbed. And we know that as dermatologists, right? Like things get absorbed through the skin. And we use that to our advantage at times. But yeah, I totally am with you. What age can kids start wearing sunscreen, right? Like, can you put sunscreen on a 1-month-old?
Well, I wouldn't fault you for doing it, but the official guidelines are to wait until you're 6 months of age or older. Earlier than that, you're just supposed to not get in the sun. But zinc oxide, which is the ingredient in a lot of mineral based sunscreens, is also in a ton of over the counter diaper pastes, and we have no problem smearing that on our babies' butts multiple times a day. So my gut says it would be fine, especially if you're not. I mean, if you're worried about it, don't use the ultra micro-sized particles, I guess, and just smear white chalky stuff on your baby's face if you want to go out there.
Yeah, but, at that age, they can't even hold their heads up, right? So you really can keep them out of the sun, which I think is the best. Keep that awning over the stroller, keep a hat on them. It's easy at that age, right, when they're that little to just physically block the sun out.
All babies look cute in bonnets.
That's right, for sure. And what about, like, sun protective clothing for kids? Are you a fan of that?
Of course, I'm a fan of it. I'm sure you are too. It's hard to be a dermatologist and not.
I'm a fan of it for me.
You probably know, listeners, that sun protective clothing is specifically designed to try to prevent the ultraviolet light from getting through. So instead of an SPF like sunscreen, they have a UPF, which means something similar. And you can just Google or look up on your favorite online retailers sun protective clothing. There's a lot of specific brands out there too, but they're usually made of like this lightweight, breathable fabric that I think feels better than a t shirt, even though it would feel strange to be wearing long sleeves when it's 95 degrees out. But again, I think they're more comfortable than a t shirt in that sort of weather. And even if you don't have specific sun protective clothing, any kind of clothing still helps like a shocking amount. Dr. Mina and I have probably both spent at least a little bit of time at a VA, like when we are training, and it's very obvious in our veterans who are like super sun damaged from the elbows down, but their back looks pretty good, and they weren't wearing like a sun protective t shirt their whole life.
Oh, yeah. It's amazing to see even, like, my golfer patients, like, I can tell they wear shorts all the time and golf socks, right? But, yes, for sure at the VA, it can be astonishing the difference in the skin between the upper arm, the shoulder, versus the forearm. I love UPF clothing. I find kids just readily wear it, at least up to a certain age. I'm getting a little pushback from my tween who wants to wear a bikini. But, I balance that with it's a long sleeve top. But I do think physical clothing is wonderful. Don't just rely on sunscreen, right? Because we all know we don't put it on as much as thickly as we should. We miss areas. If your kids are at the age where they are putting it on themselves, then, for sure, there are areas that are most likely being missed. So, yeah, have a hat on, wear sun protective clothing. I love that. I have like a little UPF shawl that I have in my car with a hat so that if I am outside and I'm wearing short sleeves and I'm going to be in the sun for a minute, I will just at least can throw that over my shoulders so I'm not like frying like a rotisserie chicken out there.
Yep. And I feel like we should also mention that despite some of the unknowns in terms of sunscreen, what is known is that sunlight is associated with the development of skin cancer. That is not a question mark. So if you're looking to do something protective that is sure to help, protecting yourself and your kid's skin from the sun is helpful.
And for people who that doesn't resonate about like skin cancer and things like that, I would say that one of the most potent agers, causes of premature aging in the skin. So you may not, or your tween or your teenager may not be worried about skin cancer in their 50s or 60s. But, if you tell them they're going to look old, then that's it's kind of a different story. At least it worked for me when I was in my 20s and going to tanning beds. Let's move on to like atopic dermatitis or eczema. This is something that I feel like a lot of parents struggle with their children and unsure what to do. I see parents doing these very restrictive diets and withholding foods because they think the food's triggering it. They're terrified about using steroids. Can you just kind of speak to eczema? What is it and what do parents really need to be concerned about and what should they do to treat it?
We see an awful lot of this in our pediatric dermatology clinics. And the number one piece of advice I have is please go see your friendly neighborhood dermatologist. They know what they're doing, they are highly trained, they will use medicines that are safe for your child's skin. And please do not follow advice that you might find on social media or the internet or from some other sorts of healthcare providers. All right, here are some common things that I think are worth knowing about eczema, which is also called atopic dermatitis. Number one is we think it's primarily a problem with the skin, and secondarily, perhaps a little bit of an immune system thing going on, but it is not an allergy. It is not a food allergy. It is not an allergy to something in the environment. It's not an allergy to something that's coming into contact with the child's skin. It's not. Kids who have eczema are more likely to have other allergies. But if you have a kid who has eczema, a dermatologist is the type of doctor you should see, not, for example, an allergist. And allergy testing is almost always not helpful. And I have seen it be harmful. So I have some patients and parents who come in and say, well, he had this rash. We saw an allergist, and it turns out he's allergic to egg and bread and milk. And so we never really had a problem with that, but we stopped him. And I don't know, I think maybe it's a little bit better or something. And then this poor child, and perhaps their whole family, has been leaving this sad, eggless, breadless, milkless life for who knows how long. Which is a huge pain in addition to potentially causing nutritional issues. And it just doesn't help. So I know this is out there on social media and the internet that diet can be related to eczema. It's almost always not. And that is a tough hurdle to jump for some of my patients' families. But there's been a surprising amount of research into this question. And the research shows that for the vast majority of children, diet is not an issue. And one reason I think this keeps coming up is eczema just kind of gets better and gets worse on its own. Presumably, there's some reason. I assume it's not completely random. That's probably molecules doing something, but science hasn't yet figured out why it sometimes gets worse and sometimes gets better. So it just kind of gets better, gets worse. Waxes and wanes, we say in dermatology. And human brains like to make up stories. So we're tempted to think, oh, it got worse. It's probably because of something I can identify. He had shrimp for the first time yesterday, and now his eczema looks a little bit worse. Probably we should be worried about the shrimp at least a little bit. But that's just not true. Try to resist that portion of your human brain that likes to make up stories. It just does what it does. And then you can focus on the treatments that hopefully you got from your friendly neighborhood dermatologist or pediatrician, etc., and focus on treating the skin. We can control the skin. Another reason I think people like to think about diet is they feel like they can control it, which is true. But eczema is inherently a somewhat uncontrollable disease. But what we can control is how we treat the skin, which we know can make it better.
100%. I feel like gluten's a big culprit, right? Like everyone's blaming gluten for everything, right? Beyond just celiac disease. And I'll see families where their kid is not allowed to have any bread, any dairy, ice cream, all the like fun stuff of being a kid. And if you're doing that for eczema, then, it makes me sad because that's not what's causing the eczema, right? And it's just causing probably a lot of heartache and turmoil in the family having such restrictive diets. So I'm glad you brought that up. So what are some things that people can do if you're a parent who has a child with eczema?
So, the way I approach it is I tell patients and their parents that when you have eczema, your skin is leaky. So, it's supposed to be a nice, firm barrier against the outside world. And in people who have eczema, it's not as much. And because it's leaky, water evaporates away, so the skin gets dry, and other stuff can get in through the leaks, which is irritating and then creates the itchy red rash that we see as eczema. So we need to address both issues. So we use bathing and moisturizing techniques to restore the skin barrier, and we use our medications to calm down the inflammation that's already there. In terms of what moisturizers to use, the thickest and greasiest things that you don't mind putting on your child's skin are the best. So the thicker and greasier something is, the more effective it is at restoring the skin barrier. We in pediatric dermatology love just plain old petroleum jelly. One common brand is Vaseline, but it can be whatever as long as it doesn't have fragrances and other additives to it. So be careful of the petroleum jelly sold in the baby section. It often has fragrances in it. Just smear that on the skin.
Which is crazy.
I know. It's specifically what shouldn't be put on.
Yeah. Well, okay, you brought up petroleum, right? I know you get parents who look at you like, you want me to put essentially crude oil on my child. Is petroleum safe? And I actually have a funny story at a patient because I do a lot of surgery. And I was telling her about her wound care. And I said, put an ointment like petrolatum or Vaseline on. And she just said, is there something more natural I can use? And I just kind of chuckled a little bit because it is pretty natural. But what do you say to that when people are anxious about, they hear petroleum and petrolatum?
Well, right now I practice in Utah, and I don't really get a lot of raised eyebrows here. I did in Oregon where I did some of my training, as you can probably guess. I tell them it's ultra purified. It's actually used as a food additive in some products, like the over the counter prepackaged, like Little Debbie's muffins or whatever. It's just like a bulking agent. So I don't think people should make a meal out of their jar of Vaseline, but it's certainly safe, and it's safe to put around the child's mouth, for example. They can accidentally rub it into their mouth or their eyes, and it's not going to be a problem. Shea butter and coconut oil are also pretty good choices. They're inexpensive, they're extremely unlikely to cause allergies, and they also are good at moisturizing. So if you really want to go the natural route, those are fine too.
Okay. That's good to know. I think a lot of people do like the thought of coconut oil. It sounds more natural, right? Sounds friendlier. But yes, don't be afraid of petrolatum. It's one of the best things out there for helping your skin barrier. So that's good to know. You had talked about bathing. And I know a lot of parents maybe get mixed messages about, if your skin is dry, sometimes people worry about drying it out even further by bathing a lot. And so they may not bathe their child, right? What's the deal with bathing? Is it good? Is it bad? Is it going to dry your skin out or actually is it going to help?
It's a little bit more complicated than that, which I think is why there's a lot of different sorts of information going around. So it's bad if you do it in some ways, it's good if you do it in a different way. And most of us who don't have eczema can just get away with whatever. But especially if you have a kid who has eczema, especially if it's more significant, then this bathing techniques I think can make a big difference. So, human skin doesn't really need soap to be clean, except in the problem areas like the armpits and the groin, but we don't really develop problem areas until we become smelly teenagers. So, especially for little kids and babies with eczema, where soap can be irritating to the skin, even those approved by the Eczema Association of America, I recommend just plain water in a bath. Baths are better than showers. No soap, no shampoo, no bubble bath, because all that stuff can be irritating if your skin is already sensitive. Just plain water. Let them hang out for at least 10 minutes. Toys are acceptable. They can hang out in there for longer if they're having a good time. And then if you feel like shampooing their little scalps at the end, you can, but then get them right out so that they're not sitting in the shampooey water. And don't dry them off afterward. While they're still dripping wet, smear them up with petroleum jelly. If you're using medicines, then put the medicine on the rash, and then the moisturizer goes elsewhere. You don't put medicine and moisturizer on the same spot. This medicine trash, moisturizer elsewhere. And then by the time you're done greasing them up, they'll probably be mostly dry. You can kind of wrap them in a towel, dry their little hair, and then take them somewhere to get dressed. And the reason that works the best is because water molecules like to attract each other because they are polar, as some of us learned in chemistry and remember very vividly. And so if you get water on your skin for any reason, a bath, a shower, a swimming pool, a romantic walk in the rain, and then that water leaves the skin because it evaporates, because it's toweled off or whatever, then that water will take more water molecules away with it. So getting wet, paradoxically, dries you out, just as you suggested. So the solution is to soak in the bath for at least 10 minutes so that the water can hydrate the top layer of the skin, and then immediately put Vaseline or something over the top so that water cannot then leave the skin. So I tell parents if you do it that way, I don't think it really matters how frequently you do it. Every day, once a week, whatever.
That's great to know, and it just brought back really great memories of my little kids when they were little, and bath time was such a special bonding time, I felt like, between myself and my kids, and they just loved it. So, yeah, I think for parents to be able to have that time with their kids and not be worried that it's hurting their skin is really important, and, yeah, putting on moisturizer when your skin is still damp, and, that's good information for parents as well.
I didn't learn this until I became a dermatologist, but almost all moisturizers do not work by putting moisture into your skin. They work by preventing your own moisture from leaving it. And I think that helps just to understand how this bathing and then moisturizing thing is supposed to work. We call it the soak and smear technique.
Yeah, I love it. Well, great. Well, speaking of bath time, some parents may have been told by their dermatologist to do a bleach bath. And I have definitely gotten some, wide eyes when I talk about bleach baths because it sounds really harsh. And you're telling parents to do this to their baby, their child. So, What are bleach baths? Are they harmful? Are they helpful? And how do you do it?
You put a little bit of bleach into the bathtub. So they're not bathing in bleach, they're bathing in slightly bleachy water akin to a swimming pool that's chlorinated. And why it might help with eczema is a little unclear. So you might think, and I think a lot of us originally thought, that it kills bacteria that could potentially contribute. But there have been some studies that say that the amount of bleach in the bathwater is not high enough to kill the bacteria. But bleach includes calcium molecules, and those have some role in the skin in terms of restoring the barrier, perhaps. Do they help? I know lots of pediatric dermatologists who would say, yeah, I tell all my patients with eczema to do it. I am not convinced. The studies that have been done don't show clear benefits, but my colleagues who are big fans of bleach baths say that those studies had some problems. So I think they're fine. I certainly don't think they're hurt unless you like pour in the whole tub of bleach. And they might help some patients. Taking care of eczema is complicated. So I try to keep it as simple as possible and focus on what I think is the most helpful, which are the bathing techniques that I mentioned, and then using the right medications. If you feel like you want to add bleach baths, though, that's fine. You just add a little bit of bleach. How much is a little bit? Well, if it's a full adult sized bath, it's a quarter to a half a cup of bleach. And if it's like a baby bath, it's a cap full. Like there's a cap on top of the bleach bottle. Just fill out that and pour a tiny little bit in. And then the other trick is you have to find real, plain, pure bleach. Probably looks scary, probably has a skull and crossbones on it. You don't want color safe or splash free. It's just got to be plain old bleach.
Yeah. And no fragrances with this either.
Right. And again, I'm not convinced about the fragrance thing. So a lot of my colleagues really emphasize fragrance free, dye free stuff. I don't think the research is convincing. But kids with eczema and adults with eczema have skin that's certainly more easily irritated than other people's, so it makes sense to avoid any potential exacerbating factor, including fragrances. That said, once people are looking pretty good, if you have a favorite lavender scented moisturizer or something and you want to try adding it back, I think that's fine. Just, pay some attention.
Yeah. I think I don't have sensitive skin at all. And I feel like I could use really whatever. But I do remember once being at a hotel, I forgot my Dove soap that I use. And I used the soap there. It was smelled amazing, super fancy bottles. And I got the worst eyelid rash, periorbital rash ever. So it just takes that one time and you're like, "Oh my goodness." So yeah, I think just the fragrances it's gotten out of control, right? Like everything seems to have fragrances. We don't need to be loading up, especially little kids, all these fragrances every now and then or one thing maybe, but yeah, I just feel like with these kids with sensitive skin, like why risk it? Just keep it simple.
There seems to be a trend toward more complicated skincare routines. And some of this is social media. I think most of us have seen this like tween directed content where these 12-year-olds on TikTok make their own videos where they have their 13-step process of getting ready in the morning. And you can watch them tap their fancy nails on their skincare bottles and then smear various stuff on their faces and mix together 3 different things and rub that on their foreheads. I think most dermatologists agree that that stuff is excessive. It can be harmful, but mostly it's just more than necessary and expensive. And I've been on the minimalist skincare train for a long time. I'm a minimalist in most aspects of my life. So for your kids and for yourself, I think less is more. What most people could use is washing their face in the morning. If it's a kid, they don't even need to do it every day, just whenever they're taking a bath. And then good moisturizer with sunscreen. And that's pretty good.
Yeah, I totally agree. And I find my kids are the age now, they are starting to care about stuff like this. So let them pick a sunscreen, right? They want to have a little fun with skincare, but they don't need to do all those steps. They certainly don't need anti aging products, but I do let them pick a sunscreen they think is fun. And fortunately, it's one that I like and use myself. So, there are ways to let them have some fun with their skincare without going totally overboard and using all these crazy products.
Parenting is tough. It's tough to know where the line is. I feel like either extreme is probably incorrect, but I think there's a lot of room in the middle. I feel that way about a lot of aspects of parenting.
Right? It's all like give or take too. I know sometimes parents or really my friends will like confess to me like, "Oh my gosh, Johnny doesn't wear sunscreen every day." And I'm like, "You know what? I don't think my children wear sunscreen every day." Right? Like,
I don't think I can be on this podcast anymore if your kids aren't wearing sunscreen every day.
I know. They're at the age, like, I can't make them necessarily, right? I just try to show them good habits, but even a dermatologist, right? I don't think they necessarily wear it every day. I try to model good behavior. I try to ask them, especially, if we're at the pool all day or at the beach for sure. I'm usually with them. But yeah, you just do the best you can, right? No one's perfect.
All we can do is our best.
Yes. So a lot of the listeners are moms, but really this could be for moms or dads too. But is there any sort of outdated or incorrect skincare advice you would like to correct right here and right now that you wish parents knew the truth?
I don't think there's anything major, but what comes to mind is the way to treat injuries. So, kids will get cuts and scrapes and stuff, and we used to think that leaving them to dry and scab over was the best, but now we know that our old friend petroleum jelly is actually the best plan. So, if your kid does get scraped up, wash the area with soap and water, pat dry, and then a thin layer of petroleum jelly and then a bandage over top. That's exactly how we treat like our surgical wounds in dermatology. And one of my colleagues likes to use the analogy of a lawn. If you've got a grassy lawn, is it easier and you've got a patch of just dirt in the middle, is it easier for the grass to grow back over that dirt if it's nice and lush and green or if it's all dry and brown? Certainly if it's lush and green. So this thin layer of petroleum jelly is just a little bit of greasy ointment that lets the new skin cells migrate across more easily. It's important for it to be greasy and not wet. That's very different because the wetness can carry bacteria, but the greasiness does not, and also serves as a physical barrier against bacteria. Speaking of which, the over the counter antibiotics like Neosporin is a common brand. You don't need that. So we see a surprising amount of people get allergic to that, and the reason it seems to work for so much stuff, I think, is just because it's mostly petroleum jelly and the antibiotics are just unnecessary. So you don't need to use that stuff unless you think there's a true infection. But if you're just trying to prevent infection, wash with soap and water, Vaseline.
Yeah, as again, someone who does a lot of surgeries, I'm every day telling people, "Don't let it dry out." I have to say, "Don't listen." Your friends and family are gonna tell you, "Let it air out, let it form a scab." But that's an old wives' tale and actually will make it take a lot longer. I say it's like a big boulder on your beautiful lawn. No grass is gonna grow under that, right? So you gotta get that thick scab off. Another thing I feel like people love to put on wounds is vitamin E. What are your thoughts on that?
I don't think the data is convincing there either, and I worry that if you focus on vitamin E oils, you will not be using petroleum jelly. So just use that. So the reason we love this stuff so much, I mean, there's a lot of reasons. It's cheap, it does a good job at all the stuff we're talking about, and nobody gets allergic to it. It's safe. It's hard to hate on it. So all of these fancy products that cost like 20 bucks for a big jug of some kind of moisturizer make me roll my eyes a little bit because they're just not as good in a lot of ways as the $4 tub of petroleum jelly you can get from your favorite grocery store.
It's not sexy, right? And it's not in a beautiful fancy bottle, but it's super effective and save your money on for something else that's more fun than a moisturizer.
Right. Fancy kid sunscreen that they get to pick out.
That's right, and UPF clothing, fun stuff like that. So you kinda made me think about something since we're recording in the summer, bug bites. This, I'm sure I hear this too, like, what can you do to prevent bug bites in your kids? Is it safe to use DEET containing products? What is your go-to recommendation? I don't know if Utah has bugs, but we certainly have bugs here in Atlanta and mosquitoes.
Yeah, there are some bugs around. So DEET is everybody's recommendation because it works and it's safe. So there are occasional reports of like really little kids, like babies, especially if their skin is all covered with eczema, who actually can develop some toxicity if you smear them all over with DEET. But that doesn't apply to most of us. So I think most everybody out there can feel comfortable using DEET on themselves and their kids. And the alternatives out there that are like the natural insect repellents, the studies say they just don't really work. So I hope that someday a good one is developed, but until that happens, you should be using DEET if your goal is indeed to prevent bug bites. So, especially if you're going to somewhere where there's like mosquito borne diseases your kids can catch, you want to be real careful. If it's just like, we're going camping and I prefer fewer mosquito bites, then maybe it doesn't matter so much. Clothes, of course. So, you want to wear long sleeve shirts and long pants and maybe tuck them into the socks and all that stuff. And then feel free to put on topical steroids if your kids do get bug bites. If you have some over the counter hydrocortisone, that's fine. If you got something that some doctor prescribed for eczema or whatever, that's fine too. It doesn't really matter what it is. I think even our strongest topical steroids that have a name like clobetasol are fine to use for a week on a 6 months old mosquito bite, even.
Yeah, don't be afraid of that because really you don't want your child scratching so hard that they're bleeding, they can't sleep, you break the skin. So, yeah, even a strong steroid a couple times is usually all it takes to make it feel a lot better. And I find, I mean, I really don't like a lot of stuff on my skin, which kind of makes me laugh because I am a dermatologist, but I will just spray like my clothing with the bug spray. And then I feel like that keeps them away, but you don't necessarily have to spray directly on your skin. You can just spray on your clothing. And then I'm amazed how well fans work. So if there is some sort of like air circulating, that seems to keep a lot of bugs away. And then just make sure you don't have standing water. If you've got a lot of plants outside and pots that just have a ton of water, that's just going to be a breeding ground. So try to get rid of that to help reduce the mosquitoes and bugs.
I agree with all that. There's not a lot of standing water in Utah.
There is here for sure. What about ticks? You guys get ticks out there?
Fortunately, no, though we'll see what happens. It seems like lots of things are changing these days.
Well, so I think it would also be helpful to remind people to check their skin, if you've been outside in wooded areas and check your pets, right? Like pets can get tick bites too. So kind of do a survey of your kids. And I think we've all, as dermatologists, had that patient come in with a changing mold, right? And then upon closer inspection, it's actually a tick.
I will admit that that has not happened to me, but it would amuse me.
It's just because you're in Utah, I guess.
Yeah, and Rocky Mountain spotted fever does not happen here. It's more like Appalachian spotted fever.
Yes, exactly. Total misnomer for sure. Dr. Johnson, this has been a lot of fun. I have learned a ton. I would love, as a pediatric dermatologist, if you can just give our listeners your top three takeaways for summer skin health for little ones this summer. Three quick takeaways.
Three quick takeaways. Keep it simple. Don't be afraid of stuff like sunscreens and topical steroids. And I mean, I don't have stock in the Vaseline company, people, but I'll mention petroleum jelly again.
Yeah, don't be afraid of that for sure. I don't either. I wish I did, but we just love it, right? It's just so good. It's so safe. It's been used for what, 150 years. So definitely a great product. Well, this has been a ton of fun. And can you just tell people, I forget if you have social media or not.
I don't, but I do have a podcast myself that's aimed at dermatologists and people practicing dermatology. It's called Dermasphere, DERMA sphere. And I am too old for social media, but we've got some medical students who do help us out, and there's some social media stuff related to the podcast. So you can find that if you're looking at for Dermasphere on whatever platforms are out there.
Amazing. Well, I will include that. And where do you practice, Dr. Johnson?
I am at the University of Utah.
Salt Lake City, I take it.
That's correct.
One of the few cities I know in Utah. So
Yeah, it's the biggest for sure. And I may be a little biased, but I'll also say the best.
okay. All right. Fair enough. It's got, I mean, that Mormon temple is pretty impressive. I have visited. So, well, Dr. Johnson, this is a ton of fun. I will definitely include your podcast information in the show notes, and I will see everyone next week.